Thanks, Sam. All right, if you or a loved one are facing a life-limiting illness, you may have heard of hospice care or even palliative care. And while they're closely related, there are two distinct levels of care. And joining us to explain is nurse practitioner Kelly Twells. Welcome to the show, Kelly. How are you?
Good. How are you?
I am good. Yeah, I've heard about both of these quite a bit lately, as all of our parents are getting older, or we might be in that position ourselves. But what are the primary differences between hospice care and palliative care?
The primary difference is basically patients that are enrolled on a palliative care program, they still have a serious illness or a terminal illness, so the patient base is the same. However, they're still pursuing aggressive treatment. For example, a cancer patient that maybe has stage 3 or 4 cancer and wants chemotherapy or radiation, they can still do that while on palliative care, because palliative, the word in and of itself, just means relief of symptoms. Oh. So our team, that's what we do. We help relieve symptoms and help people through their treatments, kind of meeting them where their healthcare goals are, whether that's comfort care only or aggressive treatment.
Okay, and how can palliative care help those who still want to pursue treatment for their life-limiting illness?
So, for example, we'll use a cancer patient again, and if they just are their goal is longevity, to get as much time as they can. They're undergoing chemotherapy, they have side effects from the chemotherapy. We are an extra layer of care, an extra set of eyes on them, helping the oncologist, working with the oncologist to make sure that their symptoms are managed. So something that maybe in the first couple treatments controlled their nausea and isn't controlling it anymore. If they call me, I make a home visit, I see what they're on, get to what's causing the nausea, and I can maybe add something or change the medication.
Yeah, that's good. Yeah. Now, what are the goals of care in conversation, and how does a palliative care or hospice care team member help guide this process?
Right. So, I mean, you want to respect the patient first and foremost, their wishes, their culture, whatever is important to them. And so when we discuss the goals of care, we mean to them, what's the most important thing to you? If, comfort, independence, being home with their family is the most important, we kind of keep opening that conversation to, maybe your disease is progressing, or, looks like you're responding well to the treatment, but we kind of keep them, on the path that's consistent with what they want from their healthcare team.
Yeah, that's good to know, because I know a lot of older folks, they fear that they're going to lose their independence maybe as the illness becomes greater. But it sounds like what you're doing is whatever they want. I mean, if they're able to, then they can have their independence as much as they can, right?
Correct. And the thing is, a lot of times the word palliative is 100% put into the bowl with hospice, and patients are afraid. No, I don't need palliative yet. I really don't need that. Well, everyone could use palliative. I could use palliative.
Yeah.
But so once our team gets in, whether it's the nurse, the social worker, the nurse practitioner, they really do appreciate us, because we do have that extra time to sit in the home, talk with them. Maybe they're having more shortness of breath because they have a valve issue, their heart's bad, and the talk is, let's do a valve replacement, but maybe that's not what they want. They kind of are like, I'm 94, I want to stay home.
Yeah, so, right, okay.
We kind of can help make that happen. So sometimes palliative is a bridge to hospice, because patients don't understand hospice a lot of times either. They think it's throwing in the towel, or
sometimes these words are scarier than the actual what they do. But yeah, Kelly, we're out of time, but great talk, and we appreciate it, and the information's on the screen. Thank you.
Thanks for having me.